Okay, I want to thank MediAsia for this opportunity to share a little bit about treatment options for prostate enlargement. Yeah, I think I want to thank Lincoln for just sharing about all the problems related to BPH, and I think he touched on a very important point, which is that oftentimes men do not seek help; they just live with it. So I'm actually quite happy to see quite a few female participants in today's talk, because oftentimes it's the wives who pick up these problems. For example, the husbands who are always planning where to go to the closest toilet when they go out, the husbands who are waking up multiple times a night and disturbing the wife's sleep. So oftentimes everyone suffers along with the patient who actually has BPH. So I come from a different practice. I do not have an illustrious urologist father, but I'm a Tan also, and we are not related at all. So this is my practice, Uro Health Medical Clinic, and these are my other two colleagues, Dr. Trisha and Dr. Tan Teck Wei. So without further ado, let's talk about treatment options. I mean, we can divide treatment options into three groups. One is what we call behavioral modification, where we change certain activities that we do. The next one will be certain, what we consider first-line therapies. And lastly, what we consider more invasive procedures. For example, TURP and prostatectomies. So let's start with behavioral management, or what we call watchful waiting. So this involves some kind of lifestyle modification. For example, adjusting your diet, when you take fluids, especially in the evening. Certain medications may make urination worse, and certain exercise patterns and all that. The potential downsides about this kind of management is that there may be progression in symptoms when you do watchful waiting. And if your prostate continues to grow, you may have reduced options for minimally invasive interventions, in the sense that if it gets really too big, sometimes we lose the opportunity to treat you with less invasive procedures, and we have to go for more invasive ones as the prostate increases in size. The good thing is that, well, there's no requirement for any kind of anesthesia, no implants, basically no treatment at all. But only about 19% of people are actually satisfied with just pure lifestyle changes as a treatment. So what do I normally tell my patients in terms of, trying some behavioral therapies? So the first thing I tell them is we do the same questionnaire as Dr. Lincoln Tan. We work out what is your symptom score. We determine, is it mild, moderate, or severe? If it's moderate and severe, we would definitely consider medications, but it's mild to moderate, yes, we can start with some behavioral managements. For example, things like decongestants, antihistamines, this can actually aggravate urinary problems. If you take certain diuretics, for example, people with heart failure, you actually increase the urine output, especially if you take the medication at night. So you may end up waking up more times at night. If you have neurological diseases like Parkinson's and all that, then without proper treatment of your Parkinson's, you may have worsening urinary symptoms. Other drugs related to antidepressants and all that can also aggravate urinary symptoms. So this is what I tell my patients often. As you can see in this picture, this man and woman, they're sitting down in the evening after dinner, playing with their dog, maybe watching TV, and the wife is using her computer. So I tell them the first thing for patients to do is, at the end of the day, your legs are always have some fluid in your legs. So you want to let that fluid to be reprocessed by your kidney so you can pee it out before you go to sleep. So normally I tell my patients 2 hours before sleep, put up your legs, just relax, let the fluid in the legs be reprocessed by your kidneys so that you can sort of dehydrate yourself a little bit before sleeping. The second thing you could do would be to limit fluid intake maybe 1 to 2 hours before sleep, especially alcohol and caffeine, because both of these drugs actually increase the amount of urine you produce in the evening. The other thing would be to avoid constipation. So I tell patients to take enough fluid in the day and enough fiber so that they get good bowel habits. And this normally reduces the number of nighttime waking by 1 or 2 times, just by doing these simple things. The next setup, if you have moderate symptoms, would be what we call alpha blockers. This is a medication. And what it does is it helps to relax the muscles in the prostate and allows the urine to flow a bit better. I think as Dr. Lincoln has mentioned, the prostate blocks the urinary tract, but the prostate is made of both glands and muscle. And this alpha blocker works on the muscle part of the prostate to cause it to relax, okay? There are certain side effects with alpha blockers. You can get a mild drop in blood pressure. So some patients do complain of dizziness, giddiness, fainting. Some people complain of a bit of fatigue. There may be interactions with certain drugs. And the other thing is with some alpha blockers, you may have this problem related to what we call ejaculatory dysfunction, where basically if you were to have a sexual intercourse and you were to ejaculate, you may end up with a dry ejaculate. So you have an orgasm, but nothing much comes out. Okay. So the only other issue with alpha blockers is 71% of people actually do stop taking their medications after a year. So oftentimes compliance with medication is not very good. The other set of medications is what we call 5-alpha reductase inhibitors. You may know it as drugs like Proscar, Avodart, maybe even Duodart, where it's a combination of both drugs. So what the 5-alpha reductase inhibitors does is actually stops the growth of the prostate and may even shrink it a little bit. Okay, and this works by modifying the male hormone. So it lowers conversion of testosterone, which is your male hormone, to something called dihydroxytestosterone, which is the active ingredient of testosterone. So by doing that, it reduces the growth factor in prostates, and the prostates can reduce in size. These drugs also have certain side effects. They can cause erectile dysfunction. Because it affects your male hormone, you may get lowered sexual drive. You may get ejaculatory dysfunction. And you may get a condition called gynecomastia, where basically you kind of develop a bit of breast while you take this drug. In terms of erectile dysfunction, the other issue with 5-alpha reductase inhibitors is that this erectile dysfunction can be persistent. What we mean by that is even though you've stopped it, it may persist for up to a year where you are unable to get a good erection. So because of this, also once again, there is 71% incidence of people stopping their medications after about a year. So in the past, if you had medications and you were not doing well, or you didn't want to carry on medications, or you had, as Dr. Lincoln has talked about, gone into a stage where you are in retention of urine and you are able to pee, then what would happen is that you would have to go for something called a transurethral resection of prostate, or TURP. And this basically is a procedure where we use a hot wire through a scope in the urine tract to cut out prostate tissue, okay? And this opens up the channel. We consider this a gold standard in the sense that normally after the treatment is almost always successful. But there are some potential side effects. For one, it needs general anesthesia. So if you're not fit for general anesthesia, it may not be a good option for you. And there is about a 5.8% retreatment rate in 5 years. But importantly, you also get some painful or frequent urination, okay, straight after the procedure. You may get urinary tract infections. There may be inability to urinate or completely empty the bladder straight after the procedure, but usually that will resolve. There can be bleeding, and in the past, we would tell people that there is about a 1 to 5% risk that you will bleed enough that we have to give you a transfusion. Very rarely, this procedure can also cause urinary incontinence, where you are unable to control your urine and it leaks. Okay. Rarely also, you may get what we call scarring or narrowing of the urethra, where we have to go in again and do some kind of reoperation to reopen the passage. You definitely will almost definitely have a problem with dry orgasm or ejaculatory dysfunction, where basically, when you have an orgasm, nothing comes out because all of the semen goes back into the bladder. This is not harmful to your body, but it's just that there's nothing coming out. So this is a diagram of what happens. So we pass the scope down the urine tract, we scrape out the prostate tissue to create a big passage. Because of some bleeding issues, we would have to keep you on a continuous irrigation for 1 or 2 days before we can get you home. The other treatment, of course, is what we call prostatectomy. This is rarely done. This is a relatively big surgery where essentially we open up the bladder and we scallop out the whole main part of the prostate to open up the channel. So it requires general anesthesia. There is a lower retreatment rate, but bleeding may be a bigger issue, and incontinence may also be a bigger issue compared to transurethral resection of the prostate. So these were the previous procedures that were available if you couldn't tolerate medications or medications were not sufficient. So since then, we've had a few new treatment options. One of them is what we call laser therapy. This can be done as outpatient or overnight procedure, and we use a laser to vaporize the prostate tissue. It does require general anesthesia, and the retreatment rate is about 4.8% at 5 years. You may get similar symptoms like painful urination, urine tract infections, risk of incontinence, much less bleeding risk, and scarring. So these are quite common with TURP, but the bleeding is much less compared to TURP. So this is what it looks like. On the left, you see this is a green light vaporization of the prostate, and we can see the green light going. The video shows the prostate being vaporized by the laser. And as you can see, as it goes along, the tissue, there's very little bleeding during the procedure. Yeah, and the tissue vaporizes very nicely. So at the end of it, you'll see that you have a nice big urinary channel. There you go. Okay, the next new treatments are what we call minimally invasive therapies for the prostate. And the reason why these therapies came about was because we were trying to deal with two things. Number one, can we give patients a good urinary flow, reduce the symptoms of BPH, reduce the deterioration of the bladder, while at the same time preventing all the side effects of the major surgeries, for example, urinary incontinence, and importantly, retrograde ejaculation, where the semen doesn't come out during ejaculation. So one of the therapies I want to talk about is what we call REZUM, or water vapor therapy. This is truly an outpatient procedure, doesn't require any general anesthesia, usually done under just local anesthesia or a bit of sedation. And it is quite impressive in the sense that the retreatment rate is only about 4.4% in 5 years. So not too far from TURP in terms of retreatment. You will or you may get some burning sensation after a treatment. There may be some blood in the semen and in the urine, but most of this will resolve after a few days. Okay, the ejaculatory volume or the amount of semen you produce may be reduced, but oftentimes it is retained. Okay, there may be a small risk of infection, and because the treatment basically involves injecting steam into the prostate, there is some swelling and a bit of time before the swelling comes down. So let me just show you a short video clip of the procedure. So essentially what we do is we pass a small scope up the urine tract. You can see the prostate here blocking. We find a place where we want to inject the steam. And then we pass the needle into the prostate. Okay, and then we inject steam. And this injection of steam lasts about 9 seconds. A small amount of steam is put in the prostate, and this basically causes the prostate tissue is destroyed. We move on to the next spot where we think there is blockage. And once again, we fire off the needle into the prostate, and then we inject the steam again. So this treatment causes some swelling in the prostate, and oftentimes you will need some kind of catheter or prostatic stent for a few days while the tissue swelling settles down. But the good thing is that at the end of 3 months or over the next 3 months, your prostate will shrink. The passage opens up because this is a directed therapy. You do not require any kind of overnight admission. You get retention, protection of your ejaculation, so you don't get ejaculatory problems most of the time. And you don't have any erectile dysfunction issues and no risk of incontinence. The next minimally invasive procedure is what we call prostatic urethral lift or pull. This is another outpatient procedure. Once again, no requirement of general anesthesia, but you do have to put in permanent implants into the prostate. The retreatment rate is also a little bit higher at 13.6% at 5 years. So almost double to almost triple the retreatment rate for REZUM of the prostate. Initially, you will have some frequency, a little bit of blood in the urine, rarely some pelvic pain. The urgency will be there and may rarely not be able to to urinate immediately after the procedure and may require catheter for 1 or 2 days. This is a diagram of what happens. So you see in A, we pass the scope once again through a urinary tract. The implant, and the implant basically pulls the prostate channel open. So by implanting a couple of these implants, we open up the urinary channel. So as you can see from figure A, where it's blocked, to figure D, by placing these implants, we are basically almost like your curtain stays, where you pull open the curtains. This is what we're doing with your prostate. So we're not actually shrinking the prostate, we are pushing the tissue out of the way. So in conclusion, benign prostatic enlargement is a common condition in aging men, as Dr. Lincoln has mentioned. And when managed early, it can prevent progression and deterioration of bladder function. So we're not only dealing with the flow issues and the incomplete emptying, but we are also looking to protect deterioration in bladder function. So we don't want you to end up in a situation where you are always, having urgency and frequency even after we've opened up the channel. So behavioral management and medications are effective in mild to moderate symptoms. And TURP and green light lasers give excellent outcomes, but they are more invasive. So newer treatments like UroLift and REZUM give excellent outcomes without the side effects of the more invasive treatments. Thank you. So if you want to find out more, this is my website. Thank you.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.